Welcome back. Welcome back, everyone online. Welcome back, everyone in the room. Dr. Wang provided a powerful framework for which to consider health equity in our work. And our next speaker is the dynamic Miss Dr. Juanita Mora, who will help us continue to be guided in this equity approach while focusing on mothers of color with asthma. Dr. Mora serves as a physician and CEO at the Chicago Allergy Center. She also serves as an attending at the Illinois Masonic Medical Center. Dr. Mora is a board member for the asthma workforce as part of the Illinois chapter of the American Academy of Pediatrics. In addition, as if this woman is not busy enough, she also serves as a member of the American Lung Association's National Board. Please help me welcome Dr. Mora.
Thank you so much for being here. I am the stretch on the afternoon. I'm going to give a quick plug. Next year, the meeting in Florida. So, woo! We're all having some café cubanito, and we're all going to a salsa club out there. Deal? Okay, what? So I get to talk today about racial and ethnic disparities in maternal health, how asthma disproportionately affects African American and Hispanic and Latino women. And I love this topic for many reasons, because I'm going to take you through the barriers that we encounter, but also I'm going to take you through solutions that we've seen in actual studies. And one of the beautiful things that I do, which is advocacy work. I love doing advocacy work, and I love doing it for communities that are underrepresented, because you have to give them a voice. And one thing I've made in my career is I'm a first-generation Mexican-American. Dad was a butcher, mom was a stay-at-home mom. I'm the first doctor in my family, so I have a loud voice. And I love representing and mentoring like the new generations, because it's important that if we look like them, then they want to be like us one day. So that's important. So just to go through some objectives, we're going to discuss asthma and pregnancy, some of the disparities that occur with asthma when it comes to race and ethnicity. We'll learn about racial and ethnic disparities in the rate of asthma during pregnancy. Perinatal and postnatal complications that we heard from our wonderful patient as well too, that definitely occur with asthma, more within these racial diverse populations. And then bridging the health equity gap. What are we going to do to give them access to care, to have them be able to have allergists in their community, to have pulmonologists in their community to treat their asthma? How do we get these doctors reimbursed so that they want to see these patients? I can tell you, as a Latina, I open every Saturday clinic 8:30 to 1 so that these mommies don't have to miss work, these kids don't have to miss school, and I serve the population. And, we're going to talk air quality, because we want to get actual electric buses into these neighborhoods. We don't want the black smoke coming out of these school buses when the kids are breathing it and they're asthmatic. We want the actual pest control within the homes. I write letters, about their housing all the time. We want increasing workforce diversity. I am on a lot of actual committees to increase Latino and African American doctors, because we need them to look like us as well too. Increase workforce diversity and increase the pipeline as well too. And then obviously technological advances. We want them to be able to have telehealth visits as well, because we want to give them access to care, and obviously advocacy. Going to Congress, having the White House listen to what these communities need. And that's what I love to do, and they kind of know me a little. So troublemaker. So then, obviously, addressing advocacy for pregnant asthmatic patients. I'm going to introduce you to a project that I've been working on with the chair of the Women's Health Committee at the American Academy of Allergy. I'm co-chair of the Women's Healthcare Committee. We've been doing Breathe for Baby, which is an asthma toolkit for pregnant women. And so it incorporates fetal movements, vaginal bleeding, whether the mommies are on biologics, because as asthmatic mommies, we need it to look different. And it's in Spanish, it's in English. We have an actual tool, and I'll give you the website. It's all downloadable and free. And we're having a congressional briefing in December to try to get it into the White House, because guess what? Dr. Joe Biden called this year the Year of the Mother. She's trying to decrease maternal health actual risks and decrease maternal mortality. We're going to take her up on it, and we're going to decrease mommies dying from asthma. So that's our work. So this is a little on demographic and clinical. So I drink a lot of coffee, as you can tell. So Latina, Mexicana. So demographic and clinical characteristic for women by race and oh, sorry, I passed the poll question. How do we go back to it?
Hit the red.
Okay.
Okay. How does maternal asthma impact pregnancy outcomes across different races and ethnicities? Answer at 2:15.
Our wonderful patient gave us the answer. Uh-huh.
Okay. 100% said number 1A.
And that is correct. Thank you. So one thing we know when it comes to disparities in asthma in women who are pregnant by race and ethnicity, Black women we know appear to be younger. They're also more frequently unmarried. They experience more prior chronic diseases such as obesity, hypertension, diabetes than looking at other ethnic groups during pregnancy. They also are more likely to have obstetric and neonatal complications, and it's all really when looked at across all races and ethnicity. Preterm birth was more prevalent among Black and Hispanic mothers, and many neonatal complications were higher among Black infants. Part of it we know is air quality, right? They're breathing worse air quality, which makes them more at risk when it comes to ozone and particulate matter of having preterm labor and having a baby that's small for gestational age and having obstetric complications as well too. We also know that Black women have the highest prevalence of asthma during pregnancy from all races at 10.8%, more likely to experience asthma exacerbations during pregnancy, and African American and Latina women are more likely to experience poor perinatal outcomes. Other risk factors for asthma exacerbations during pregnancy include moderate and severe asthma. So when we looked at asthma itself, when we looked at women of color, their asthma tended to be more complicated, more moderate, more severe. Maternal age, younger. Obesity was a big problem. Smoking, being exposed to smoking environment in the family. Depression and anxiety also were higher rates, as well as parity. So we know I'm one of 5 children in my family. I don't know any aunt that has less than 4 children in my family. So obviously they have lots of kids. So this is one of the things that we see. And we know that increased parity is going to be an increased risk for asthma exacerbations as well too. Potential determinants of disparities include one, insurance status. That's the big one that I always see. It's the most important of the socioeconomic factors, but it's the one that stops them, right? First of all, if you can't breathe, nothing else matters. You can't afford an inhaler. An inhaler right now, when you're talking just a regular Advair, a regular Symbicort, $185 to $200 out of pocket for people who have no insurance. Albuterol inhaler, you're talking $80, $90, depending on where you go. So for many people, it's going to be putting food on the table for their kids or buying their inhalers, which is, as a doctor who does private practice, this is why I love actually pairing up with pharma and having free samples in my office, because often I will give these free samples to people without insurance because I know these are the people that need them. Like I can fight for other people with insurance who maybe they're not approved on this inhaler, but I can fight for them at least. But these people, they're the ones that are a little bit lost, where we have to do more for access to care and medications as well too. Prenatal care and utilization education. So a lot of them are, single mommies, they're working full-time jobs, trying to make ends meet. So having hours where they can get to the doctor is going to be very important. Maternal education, as we said, breaking down language barriers, educational barriers as well too, and access to care, number one. So obstetric and neonatal complications in Black and Latina women obviously include maternal hemorrhage, small for gestational age babies that basically occur, hypertension, preeclampsia and eclampsia are big in the Latino and African American community, as obstetric complications as well. So when we look at Black and Latina women, they are more likely to experience early labor and delivery, have high blood pressure, which can lead to preeclampsia, and low birth weight for these babies as well too. When we look at the big picture for asthma in the United States and Black and Latino communities, they're low-income populations, minorities, and children living in inner cities. And they experience more emergency department visits, more hospitalizations, and deaths due to asthma than the general population. The burden of asthma falls disproportionately on these communities and some Hispanic, especially Puerto Rican actual populations. One of the things that we know, though, is one of the emerging Latino communities that is not even on the map here with increasing asthma prevalence is the Afro-Latinos, because they're both African, they're both Latinos. There's 6 million of them in the United States. Celia Cruz was a big Afro-Latina. And one of the things we know is they have an increased prevalence of asthma as well, too, so something for us to note. Psychosocial and socioeconomic factors. They spend more time indoors, overcrowding, and access to care. So remember, Latino African American communities tend to have multiple generations under one roof, which means more prevalence of disease, more prevalence of RSV, COVID-19, flu. These are the homes where grandparents take care of the little kids that bring home RSV and get the asthma exacerbated, etc. So this is why when they get to my clinic and the grandparents come with the little kids, everyone gets RSV vaccine, everyone gets a flu vaccine, everyone gets a COVID vaccine, because we want to protect the whole familia. This is what I tell them. And when we look at asthma disparities and the state of the air, so I work a lot with the American Lung Association, and one of the big campaigns that we have every year is the state of the air. And this is what this year's state of the air report for the United States told us here in the United States. Out of nearly 120 million people who live in areas of unhealthy air quality, a disproportionate number, more than 64 million, that's 54%, are people of color. In fact, people of color are 64% more likely than white people to live in a county with a failing grade for at least one measure. So ozone, short-term particle pollution, or long-term particle pollution as well too. 3.7 times as likely to live in a county with a failing grade for all three measures: the short-term particle pollution, long-term particle pollution, and ozone. And if you have asthma, you can't breathe, nothing else matters. I always explain this to people. Look at the people who live near the wildfires in California. It's Bakersfield. Bakersfield, predominant Latino, poor area in California. Look at here in Chicago where I am. If you look at the areas, for example, that are very Latino populated, like Little Village, there was a plant demolition there that was unauthorized, caused asthma exacerbations in kids who were playing outside in their yard that day. And we saw them in completely wheezing episodes, asthma exacerbations, older people that were very affected. So we need to do more to clean up the air, not only short-term particle pollution, long-term particle pollution, greenifying these neighborhoods as well too, and electrifying vehicles as well too. And I'm working on indoor particle pollution as well too, because gas stoves can be a real problem with nitrogen dioxide, and we got to get the resources to these communities of color as well. So how do we bridge the health equity gap? I've given you all the problems that we see, but what are some of the things that have been done? So health disparities, defined as health difference closely linked with social, economic, and or environmental disadvantage. in asthma continue despite the presence of safe and effective treatments. So these neglected communities lack access to quality primary care and especially have limited access to subspecialty care like allergy and immunology or pulmonary. And they lack access due to structural barriers such as inadequate reimbursement. So I will not name the hospital, but there's a hospital that completely refers all the Medicaid patients to me so that they can get allergy shots and they can get their asthma care and everything else because they won't take Medicaid. And you know what? I say, God will bless me more. Tamales are never missing on a Saturday clinic from someone who cooks me tamales to our office or different things. Because you have to do a balance, right? And it's all about a balance. I have my private insurance patients, but I also have my public aid, and I love them. And I love being able, and one thing I always do, I never look in a chart to see who's who. I go into a room and I say, all right, let's treat Johnny, let's treat Mario with this, or let's see how this family's doing. Because everyone is a family, and I'm blessed to be their doctor. And that's how I see it. and I think we need to do more of that. But like I said, they'll always bring you food, so take their insurance. My hips don't lie. No, so we wanted to obviously be great populations reliant on Medicaid, but we need to get also doctors reimbursed so that they can see more of them, right? That's going to be important. Also leads to overall healthcare deserts within many communities of color, especially when it comes to specialized cares, because many patients are required to travel miles for outside for a specialist. That's a huge problem when they don't have a car, they don't have enough money to pay for an Uber, they're waiting for maybe a family member to be available to drive them to that appointment. These are realities that I hear from patients all the time. Despite the existence of two major management guidelines, as we heard today, GINA guidelines and then NAEPP for over 30 years, guess what? Asthma morbidity hasn't changed. So we're doing something wrong, which means we have to do something different to change the numbers here. New therapeutic advances such as biologicals offer potential for even greater effectiveness in the treatment of severe asthma. However, obviously there's lack of inclusion of Black and Latinos in these clinical trials. So there's mistrust that we know is there, but we need to diversify the clinical trials so that way we have more data on how these medications work on these patients as well too, which is going to be very important. Another facet of tackling disparities is to expand our vision of how and where care can be delivered. So one thing the pandemic taught us is, look, we got to go to trusted services when it comes to asthma. In Chicago, we do a lot of asthma services within the school systems because we can capture the kids there. The asthma mobile van as well that can go there. We go to the neighborhoods like health fairs, right? And this is where we can capture them. During the pandemic, we went to churches. You go to where there's a trusted person they trust. Latinos, we go to Catholic churches, we go to the Baptist churches with the African American community, and then haircuts. We know that the Black community trusts their barbershops. So guess where the COVID-19 vaccines were being given? At these barbershops. And in Latinos, one thing that we did in Chicago that I thought was kind of cool is a lot of kids, a lot of Latinos are into boxing. So they went to boxing gyms, and this is where they gave the COVID vaccines as well too. So you got to partner up with community organizations where there's trusted leaders, so that way we can go in there and do a lot of the education that's needed to reach these young people, these adults as well too, which I think is going to be key. I also, with the American Lung Association, have tried working with a lot of influencers. So I was telling my table, we tried working with Drake for an anti-vaping campaign. And so, we write to him because he scolded an actual person who threw an e-cigarette in one of his concerts. And I'm like, this is the time to get Drake. He's a parent now. He's good. Let's go. And we fist pumped at him on social media. We said, oh, Drake. And we're like, Drake, let's do an anti-vaping campaign. This is your way to reach the young people. And he came back to us and we're not interested. And we're like, he vapes. But you find someone who's good. You find someone who's good. So like I said, mobile asthma, environmental factors. So decreasing exposure to harmful environmental elements can decrease the amount of asthma medications required to control asthma morbidity. And obviously substandard housing present in neglected area adds to the challenge of an environmental intervention. So I love, with the American Lung Association, we ran an environmental program where people would go to the people's homes, and some of my patients participated, and they would actually give them dust mite covers. And if there was one bed in the home and 3 little brothers were sleeping in it, they would buy 3 separate beds, so each of the kids would have a bed. And I think these type of programs are so important because we need to reach them at where they stand, where they are. And I think, everyone is different. Every family's tackling a different actual barrier. And I think if we reach them one by one in our communities, I think it's going to make a huge difference. This is where I'd like to partner up with a lot of the community clinics that are in the neighborhoods and just go in and do talks. Like I'm doing, November, I'll be doing 2 talks in 2 different Latino communities, and it's on the vaccines and just the importance of it and bringing down barriers. Because if you become a trusted voice and a trusted face, then they're more willing to work with you and talk to you, and you break down these barriers that they have. In environmental interventions generally focus on the patient's home, but we must do more to clean up the air quality in communities of color. Technological advances, like I said, is going to be important, especially offering telehealth, to offer an opportunity for them to have these visits available. Recognize resources for improving diversity and inclusivity of the workforce and the patient pool. So increasing the number of Black and Latinos in the medical workforce, because representation matters. As soon as I talk Spanish to a little grandma that comes in with bad hives or bad asthma, her guard comes down. And she actually starts telling me what's causing her asthma. Well, it's every time I cook this really spicy food, stop cooking it. You can talk to them in their language, which is really good. Have your husband stop smoking. Like there was one little kid that wouldn't stop asthma exacerbating. The dad was smoking weed in the house every single day. And the mom would not tell this man to stop. So I said, bring him in, I'll tell him. And so, which I did. So he comes in the room and I said, look, your child is not going to get better. Your child is not going to stop having asthma exacerbations until you stop smoking weed. And I hope you understand. So either you care more about his health or your actual addiction. And he was like crying. I made him cry. He stopped. The kid's so good now. But you have to be real. Yeah. So also working with state and national medical associations to ensure programs such as Medicaid offers services, medications, and technologies that have been proven to improve asthma outcomes. We need to do more advocacy efforts to address wealth inequity, environmental injustice, food insecurity, educational inequity, and overall structural drivers of asthma health disparities. So when we talk about Breathe for Baby, this is a project that we've been working on with the Women's Health Committee through the American Academy of Allergy. Also involved is the vaccine advocacy program as well too. And it's really an asthma action plan and an ACT score and a small, simple one-pager that incorporates what are the medications mommy should be taking all the time, including fetal movements? Is the mommy feeling the baby move? Remember, and I always tell this line to the moms, if you can't breathe, baby can't breathe. So it's going to be so important. And we have it in English and Spanish, including rescue medications. Are they on any biologics? Any vaginal bleeding that they're encountering as well too. This is the pregnancy asthma control test that incorporates those things as well too, because that was one thing we said, we can't treat asthma the same way in someone, a kid, an adult, and someone who's pregnant. A woman who's pregnant has a whole other baby growing in them. They have vaginal bleeding, they have fetal movements they have to incorporate. So this is after many, many years of clinical studies that this project came to actual light. And this is Pregnant with Asthma. It's a one-pager, again, available in English and Spanish. We want to have it in many other languages with a green zone, a yellow zone, and a red zone. Very easy to understand, which makes it basically very relatable as well too. So one thing we've been doing with advocacy and Breathe for Baby is we met with Dr. Diana Ramos. She is the general surgeon for California, who's an OBGYN by training. And one of the goals for her actual term is to decrease maternal health risks. And one of the actual disease states that she pointed out with that was asthma. So I met her through the National Hispanic Medical Association, and I told Jennifer, we're going to hit her door. So we set up a meeting with her, and actually we just met with her in October. And we're trying to connect with the American College of Obstetrics and Gynecology, getting her, she's serving on Dr. Joe Biden's actual committee as well too. And we're working with the White House and have a congressional briefing coming up in December, so that way we can get this asthma action plan to go on a national level and spread it. So I hope you guys will help us spread it too, because it's a really good thing. This is the actual website for the Breathe for Baby link. All the tools are available in Spanish and English, and the ACT score, the asthma action plan, and then the little tidbit one pager as well too is there as well too, which I think is very, very important. Conclusions: Latino and African American pregnant women with asthma have higher risk of prenatal and postnatal complications. Bridging the health equity gap includes access to care, education, environmental justice, improving quality of air, using technology to reach these communities, more access to subspecialists in the community, increasing workforce diversity to meet the needs of the growing communities, and advocacy. Advocacy can involve efforts at the local and national level. Breathe for Baby is a step forward at addressing and individualizing asthma care in pregnancy, taking into consideration mommy and baby, and hoping that our efforts will contribute to decreasing maternal mortality, the Year of the Mother 2024.
Just wow? That's all I'm not even going to look at my little piddly notes. Just wow. Thank you. Questions online. Want to go first?
Hi, there's not any online questions.
Okay. How about in the audience? Yes.
I have a question related to clinical trials. What would your advice be to industry and sponsors who are trying to improve the diversity in their clinical trials? You mentioned some of that mistrust that exists in communities, and obviously that's not from thin air, that exists for reasons. So how would you suggest that people kind of break down those barriers and try to make clinical trials more accessible for the historically underrepresented communities?
Great question. So one of the things that we're doing now at a national level, actually I got an email right before I got on here to talk from the American Lung Association. We're running a campaign for the Latino and African community to kind of bring down the barriers of mistrust to diversify clinical trials. One of the things we're doing it is by doing a national campaign on the news. So going local and national news outlets and talking about, why it's important. One, they get to try the newest drugs that are yet not on the market, and maybe they've been failing when it comes to their asthma care or their cancer care, and this is a way of them trying a new medication that might really work and help them. Two is telling them, obviously, decreasing the barriers of mistrust, saying, now clinical trials are very observed. There's a lot of diversity within them. We're trying to increase diversity even more. This is our chance to contribute to the education that happens with the drugs. What are the side effects, etc. But this is something that we're working on now. You're welcome.
Another question.
Sorry. I wanted to piggyback off that real quick, Mason, is that my parents immigrated here from Mexico in the 70s, illegally at that, became legal through the birth of one of my oldest brothers. But I think to that point, as far as decreasing the barriers and meeting people where they are, is telling people it doesn't matter if you're not legal here. Mm-hmm. It's okay. So I volunteer at a community clinic where it's free healthcare, free medication, and a lot of people go in there. They walk in there in fear of being deported or being, their name being out there. So I think that could be, if you market in a way that you're meeting people where they are, like a lot of people have said today, is that it's not about your legal status. Let's work together to improve healthcare for people of color, low income status, all the things, so that it's not about if you're legal or illegal. That can be another, political topic, but the point is moving forward with research and healthcare and health equity for all.
In your studies, you obviously, we're both Latinas, and but did you also take in consideration how complex we are, and we have a common language, but we're so different from each other, and how our diseases are treated, culturally? Is that something that you see in your practice? Not talking only to Mexicans, but somebody from Cuba or Puerto Rico. How do you address that?
Absolutely, and I call it the cultural competency. And sometimes you have multiple generations in one room, so you can talk to the abuelita about the vapor rub on her chest for her asthma, the teenager, why they should be taking their inhaler, and the little té de canela or té de manzanilla that they take. So it's really also, I think, part of being a Latina that I appreciate is being able to respectfully say, you can keep taking your tecito, you can keep putting the vapor rub, but let's try this inhaler. I think this will help. And you kind of get in the education as well too, but you do it in a way where you're doing it respectfully.
Thank you, Dr. Mora.
You're welcome.